Jumper's knee or patellar tendinitis, maybe you've had it or dealt with it in the past, maybe you're currently dealing with it. In this video, I'm gonna teach you what this is and what you could do to fix it. What's going on? Dr. Nick Bonforte, physical therapist. So jumper's knee or patellar tendinitis, what is this? This is irritation to the patellar tendon, the tendon right beneath your kneecap. How does this happen? This happens when there's a lot of excessive force and activity that you're doing, such as jumping in basketball, that tends to put stress, excessive stress to this area of the patellar tendon, and then it sparks up. So every time you maybe lunge and you put load through your knee or you jump, it sparks up and it's painful and it limits you in the things you want to do. In this video, we're going to be addressing when it's initially hurting you, what you can do to help decrease the pain and start to build up some strength and adaptation to this area. When this area of the knee is sparked up in pain, knee dominant movements will tend to spark up the symptoms because there's too much loading and force going through that region. So we're gonna fix this by doing isometric training. That is the one that we're gonna be addressing to ultimately lower pain and improve the loading capacity to this region so that when you take on more force, it's able to do that. So it's gonna be a systematic approach when we're going through these things. We're gonna be going over 3 progressions using a wall sit. Let's get into it. Okay, so we're gonna be doing isometrics to the knee using a wall sit. So you need a wall that you're gonna be able to lean up against. We're gonna do some progressions off of that. The first thing that we're gonna be doing is just a simple body weight wall sit. So from here, depending on your strength levels and the irritation to your knee, that'll depend on the depth. But in this case, we're gonna act as though we can get this roughly this 90-degree angle. From here, the back stays straight on the wall. Hands could be either here like this or on the hips. But from here, I feel my quads engaging, and then when the patellar tendon is sparked up in discomfort, you might get some of that irritation to the front part of the knee, where the irritating factor is. Now the concept with this, when we're holding this for an isometric, we are putting load and progressive input into this region to ultimately strengthen up the patellar tendon to withstand more force. So the idea is you don't want to be sitting in this position and going too much into the pain and making it worse, but the idea with this is to strengthen up the patellar tendon and the quads so that it can tolerate more force, because it's a very knee dominant movement given how the chest is up against the wall. Okay, so the next one, we are progressing the wall sit by lifting the heels up in the position. What this does is put more load to the quads. Here's how it looks. We're getting in this wall sit position again, and then from here, I'm gonna lift my heels up and I hold it. What that does is put more load to the quads, and I can come back down. So I could hold it for a duration of time. I could rep it out, obviously under controlled. So duration of time, 5, 4, 3, 2, 1. Or I could just rep it where it's a second and then down. And then you're gonna be repeating that by lifting the heels, and it's a progression off of this isometric to again put more load to this region to adapt more force to it. Okay, the last progression of this wall sit is lifting one leg. Obviously that will be putting more load and effort to the quad and to the patellar tendon. Here's how it looks. We're gonna be again in the wall sit position, and then from here, I'm gonna lift one leg up and then down. One leg up and then down. That one you hold for a duration of time, or you could just rep it out like I'm doing here. And what this does is put more effort and more load to one leg, biasing the strength to the region that we're trying to target, which is the quad leading into the patellar tendon, to ultimately withstand more force. So there you go. Those are some progressions that you could use using a wall sit to progressively adapt the quad and the patellar tendon to withstand more force and more load to ultimately improve the strength, so that when next time you put more load through it, such as in a jumping activity, it's prepared for that. Now this is one thing that you can start to implement. Obviously there's other factors that go into the whole process of jumper's knee rehab or patellar tendinitis rehab, such as modifying knee dominant movements, targeting hip dominant strategies, etc. So there's a lot more, but this is one exercise you could do to start reduce the symptoms of pain and improve the loading capacity. So hopefully you found this video helpful. And if you did and you want to learn a little bit more about how your body is moving, then check out my website. There's a free masterclass training on there. Check out some of the programs on there. Link is in the description or somewhere on this video to click. It has you right over there. If you found this video helpful and found some value in this, also please like, subscribe, leave any questions or comments below, turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.